After what was a long call for equity in administering the COVID-19 vaccine in Africa, it has been said that unprecedented global circumstances have slowed the process of rolling out the vaccine. Well, doses of the COVID-19 vaccine have arrived in the Gambia, here at the Banjul International Airport. This is the historic moment. COVID vaccines from the United Nations COVAX scheme arrived in the Gambia. As this consignment reaches the Gambia, millions of other jobs are also being delivered to low-income countries who all are set to benefit from the WHO vaccine initiative being driven in partnership with ACT, Accelerator and G7 nations who have pledged $7 billion to support a coordinated global vaccination effort. A total of 36,000 COVID-19 doses arrived in the Gambia through the WHO and UNICEF. Officials from the Health Ministry were at the airport to receive the COVID jabs, which come amid renewed efforts to mitigate the spread of infections and the deadlier UK variant earlier detected in the country.
The COVAX will provide vaccines for 20% of the population of the Gambia. The allocation will be able to vaccinate all those who are aged 40 years and above, including priority groups. This summing up to over 480,000 Gambians as projected in the 2013 census.
Thousands of COVID-19 cases were recorded since 2020, plus an overwhelming number of deaths that include frontline health workers. The vaccine doses, according to officials, will be categorically coordinated for effective distribution among the populace.
In Africa, actually, we are among the very few that we are fortunate enough to receive the first batch of the vaccine. So this is quite a fortunate event for us. As you know, COVAX is one of the three pillars of what was established as access to COVID-19 tools. Accelerator. One wing is for treatment, the other wing is on diagnostics for COVID-19, and the third one is vaccine, which is also important.
The arrival of COVID jabs ignites hope for the Gambia's fight against a pandemic that has claimed lives and ushered in unusual circumstances.
The vaccine is the biggest weapon the globe has, the entire globe has towards the control of COVID. There are many other weapons, but this is the most significant weapon. We are praying and hoping that if we can actually escalate the vaccination program in the next couple of months before the end of the year, we can vaccinate enough Gambians to start building our economy back, start getting people's lives back, and start getting the social fabric of the country back. That is the hope of this vaccine.
According to statistics, UNICEF is leveraging its experience as the largest single vaccine buyer in the world and working with manufacturers and partners on the procurement of COVID-19 vaccine doses for low-income nations.
This is part of an international agreement which is called the COVAX facility, which is an arrangement which is led by the Gavi Global Vaccine Alliance, with the support of WHO, UNICEF, and the support of numerous donors and organizations across the world, with the sole purpose of being able to secure a reasonably good number of COVID-19 vaccines for countries that do not have the resources to buy the vaccines on their own. And the whole purpose of this arrangement is to ensure what we call vaccine equity. In other words, equitable access to all of the vaccines.
From struggling to stay alive to finding a vaccine for a virus that has claimed millions of lives, COVAX raises global optimism in the battle towards recovery. The next task is to ensure effective vaccination. Officials called on all and sundry to believe in the efficacy of the vaccine and refrain from spreading fake messages about the COVID jab. This is a historic moment for the Gambia after battling with COVID-19 for months. Now that the vaccine is handed over to the Ministry of Health for administering, officials believe that this is a very significant step to help in combating COVID-19. Aminata E.Sanyang, GTS.